How magic mushrooms are on the fast track as a treatment for depression. People with depression who can't get better with antidepressants are forced to try an antipsychotic medication. There are currently no other treatment options. There are medications that can fit this medical need, such as Abilify and Rexulti, but a newer medication is ketamine, also known as Spravato. We also offer anticonvulsant treatment and TMS. Most people don't get completely better with medication, however, for some people, not getting completely better is tolerable. Nevertheless, you are still most likely to experience some side effects, like weight gain, and feel miserable. Psychedelic mushrooms contain the compound psilocybin, which is used in new compounds. When you consume psilocybin, you will experience hallucinations due to a brain chemical that activates the serotonin receptor on the neuron. Recreationally, it broadens your thinking and relaxes you, and amplifies your emotions. Having said that, studies have shown a reduction in neurotic behavior and a decrease in authoritarian behavior after the consumption of psilocybin, even after 2 doses. Authoritarian political views mean you prefer more government control, while libertarianism means that you prefer freedom from government control. Neuroticism is a measure of mental vulnerability to anxiety and depression. 1 or 2 doses of psilocybin lead to increased mental flexibility and decreased anxiety. Interestingly, the changes in attitude were seen 7 to 12 months after the first and second doses. Here is a brief history of psilocybin, which does not need to be consumed on a daily basis in order to control its effects. The first experiment with psilocybin occurred back in 1950, which led to Sandoz Pharmaceuticals' approval of indicybin in 1960. We pushed back against the endorsement of a hallucinogenic drug when it was marketed for 6 years before it was banned. The Comprehensive Drug Abuse Prevention and Control Act of 1970 classified drugs according to their potential for abuse, accepted medical use, and safety under medical supervision. The 5 categories they created are called schedules. Schedule 1 drugs are those with a high potential for abuse, no known medical use, and no safety data. The Schedule 1 class includes drugs that are medically important but have a high abuse potential, such as psilocybin and LSD. All other schedules are considered controlled substances. Drugs with a Schedule 2 classification, for example, are opioids like oxycodone, stimulants like Adderall are Schedule 2 drugs. There is a Schedule 3 medication such as ketamine and benzodiazepines, such as Klonopin and Xanax, and a Schedule 4 medication such as Ambien for sleep. In Schedule 5 are drugs that are least likely to be abused or dependent. Lyrica, Lomotil, which gives you diarrhea relief, and cough medications containing codeine are among the drugs on this schedule. Not all medications are scheduled drugs because not all medications are considered to have abuse potential or dependence. In the end, psilocybin is not a scheduled controlled substance like antidepressants. Several studies have shown that psilocybin is therapeutic for people suffering from anxiety, depression, and alcoholism. Psilocybin has been used in many studies as part of a technique called microdosing, which has been accumulating for several decades, gaining the attention of long-term pharmaceutical companies seeking to develop the medicine. Psilocybin's early results were so promising that the FDA granted it breakthrough therapy designation. Breakthrough therapy designations allow drugs to be developed and approved more quickly. Spravato, marketed as S-ketamine, also works against treatment-resistant depression. You may wonder how long it will take when it is on the fast track. That depends on how long the trials take. A breakthrough designation was given to Spravato in August 2016, and it was approved for use as a treatment for depression in March 2019. The FDA approval process takes an average of about 10 years from phase 1 trials to FDA approval, which sounds long. However, on average, it takes about 2.5 years. The rapid passage of drugs that have shown they can treat life-threatening illnesses will enable them to get to market faster because of previous evidence that they're effective. Compass Pathways was granted breakthrough therapy designation by the FDA in 2018 for use with treatment-resistant depression. A single dose of Usona institutes treatment for regular depression, not treatment-resistant, was approved by the FDA in November 2019. Is it possible to be drug-free for months with just one dose? Both companies, Usona and Compass Pathways, are in the second stage of their clinical trials as of the date of this video. It is still possible to volunteer for both companies' trials. If you're interested, go to their websites for more information. Both companies are conducting trials in Europe and North America. Usona conducts trials primarily in the United States. There is a difference between bipolar depression and unipolar depression. Psilocybin is being studied for unipolar depression. We don't know what effect it will have on treating or triggering mania or psychosis. The drug may not be able to completely alleviate the depression associated with bipolar disorder, but we'll have to wait until after they've completed the trials before we can predict its effects on bipolar disorder. Despite the fact that we do not yet know much about the side effects and safety issues, I believe that they will be minimal due to the microdosing. As a result of the limited exposure, there should be limited negative effects. So, fingers crossed. See you next time.